Hi everyone, thanks for joining us today on this virtual Meet the Expert session. My name is Amy and I work for the My World of Work live team within Skills Development Scotland. It's our job to help you understand more information about future jobs in Scotland and what skills are needed for those careers. So today we're going to cover a quick overview of the healthcare sector. I'm going to introduce you to our two experts today. We have Hannah and Scott from the NHS, and then we're going to have a live Q&A. So I would encourage you to get as involved as possible by using the Q&A box to the right of your screen. You can ask questions anonymously, but if you don't feel comfortable taking part, you don't need to. I do have to let you know that this session is being recorded for any young people that couldn't make it today. The session will be available on the My World of Work YouTube channel, so you can go back and rewatch what we've talked about today whenever you like. So because we have two experts today, if you have any specific questions, so if you have one question for Hannah, please put her name in the expert so we can get the right questions to the right people. So I hope you enjoy the session, and I'm going to quickly talk you over the healthcare sector. So the healthcare industry is the largest in Scotland. Over 400,000 people work in this industry, and it's one of the only industries that have managed to keep working during the times of COVID. So that's 15% of all Scottish employment is in healthcare. But there were over 5,000 vacancies last year, and most of these vacancies are due to skill shortages. So 24% of those are due to lack in skills. This is because the future of healthcare is becoming so digitalised. There's so much more new technology, and we need to learn these skills so that we can use them. So from 2019 to 2029, almost 80,000 jobs are going to be required to replace this demand of an ageing workforce. So looking into the future, the top 5 jobs in healthcare are going to be carers, nurses, therapists, medical practitioners, and public health professionals, which works in the interest of the public, much like what we're all experiencing right now with our masks. So today's two experts are called allied health professionals. So these are professionals that aren't necessarily nurses, so things like radiographers, paramedics, music therapists, speech therapists, and then we have Hannah Kennedy, who is a podiatrist who works with feet, and we have Scott Bullivant, who is a dietitian, so works with food and diet. So both of our experts today decided to change their careers to pursue a more rewarding role within the NHS. So their stories and their career journeys are really interesting. We're really lucky to have them today. So first we're going to hear from Hannah, and she's going to tell us a bit about her journey so far, and then we'll hear from Scott. And after that, we can take any questions that you might have. So I'm going to pass over to Hannah now.
Hi there everyone. So my name's Hannah and I'm a specialist podiatrist working in the NHS. So I left school when I was 17 at the end of 5th year, and I didn't know what I wanted to do yet, so I moved up to Edinburgh to look for a job. I got a job working in Lothian buses, where I worked in the travel shops, park and rides, and at the airport selling tickets. During my time there, I gained an SVQ Level 3 qualification in customer service and retail sales. But my sister, she was studying nursing, and I decided that I'd quite like to work in healthcare also. So in 2007, I started studying podiatry at Queen Margaret University in Edinburgh, and I completed a BSc with honours in podiatry, which took 4 years. When I graduated, I worked in NHS Lothian for about a year before securing a job over in NHS Fife. So a podiatrist is a healthcare professional that specialises in the assessment, diagnosis and treatment of a variety of conditions that affect the lower limb and foot. We help people who are at risk or being impacted by issues relating to their feet and legs, and help them improve mobility, reduce pain, and reduce the risk of any serious complications. My role's changed slightly since March due to COVID, because we've had to cancel many routine treatments and only see critical care. Critical care in our service is patients who have got a life or limb-threatening condition who are at risk of amputation or serious infection. I'm usually based in a GP surgery, but at the moment I work in the hospital doing a clinic there, and I also do home visits and video consultations. So my role is a general specialist podiatrist, and I see patients with a variety of conditions. So I'll now explain that in a bit more detail. I provide care to patients who have different types of foot wounds, and there are different kinds of foot wounds that can be caused by things like pressure, poor blood supply, or injury. And these patients have usually got underlying medical conditions like diabetes. We see patients with wounds that can be as deep as the bone, or patients who have skin which is necrotic, and this is when it goes black, it dies and goes black, so you can imagine how serious this can be. So I would assess factors that might affect wound healing, like circulation, sensation, and sometimes we have to refer patients for further investigation, like x-rays, MRIs, blood tests. Treatment involves wound debridement, and this is when we use a sharp scalpel to remove unwanted dead tissue from the wound. We apply different dressings to try and promote wound healing and to protect it and to reduce the risk of an infection. We provide offloading devices, which are boots that help take the pressure off a wound, and we can refer patients for special footwear. And we even use maggots, which is called larvae therapy, to help eat the dead tissue from a wound sometimes. So also sometimes patients, we have to get them admitted to hospital for urgent treatment for spreading infections or operations to help improve their blood supply or an amputation. I also see lots of patients that have got common muscle and bone problems, and this is called musculoskeletal or MSK. So we watch how people walk, which is called gait analysis, and look at the range of movement in different joints in the feet. We would provide stretching and strengthening programs and also prescribe or manufacture insoles, orthotics, which are inserts that go into your shoe to help with foot function. We've got MSK specialist podiatrists that see more complex cases, and they've also got extra qualifications, so they can do things like acupuncture, steroid injections, laser therapy, and they have got special gait analysis equipment. I commonly help people with complex nail and skin problems like ingrown toenails, corns, callus, which is hard skin. And that can sometimes be quite painful, so we need to make insoles and things to try and take the pressure off where that skin is building up. We do nail surgery, and that's when we give patients local anaesthetic, and then we remove the toenail and then we put a chemical on it that stops it growing back. I give lots of health promotion and education and work with patients, families and carers to support them to manage their conditions. We also work closely with other health professionals like nurses and doctors, physios, and departments like vascular, which is to do with your circulation, orthopaedics to do with the bone, and dermatology, which is skin. I also went back to uni in 2016 to study non-medical prescribing, and this helps me in my role because it means that I can write prescriptions for some medications within my scope of practice. So the most common medications that we would prescribe would be antibiotics, painkillers, different types of creams like antifungal creams, steroid creams, moisturisers. So my role is very varied, it's very diverse, there's lots of learning opportunities. So there's the option to develop as a general podiatrist, doing a little bit of everything, which is what I do, or specialise in one particular field. We've got specialist clinics for children and young people, MSK, rheumatology, which is a type of arthritis, learning disability, care homes, tissue viability, which is wound care. We've also got hospital podiatrists that see patients on wards, e-health and research. Okay, and the reason why I love my job is because it's not just about feet, it's about the whole person, and it's really rewarding being able to make such a difference to people's lives. People are often in a lot of pain and they're not able to do things that they love, so it's really nice helping them get back to those things. Okay, thank you.
That's perfect, Hannah. We've already had a lot of horrified questions about maggots, so we'll get to that in a second. So next we're going to hear from Scott, who's a dietitian. So Scott, would you like to tell us a little bit about your career journey?
Morning, everyone. Yeah, so mine, like Hannah, I've got maybe a different career path to getting here from the conventional high school to uni to the job. I left school when I was still 15. I didn't think higher education was for me at that point, so I got an apprenticeship and became a joiner. So did that for 4 years, and as soon as that finished, I moved from the small town I was living in up to Glasgow and became self-employed joiner. So I did that for about 8 years and kind of progressed as far as I thought I probably could progress in that field. And I got to around about 28, and I'd always had an interest in health and sport and thought, what could I do with that? So I looked into it and saw that you could become a dietitian. Didn't really know what that involved to start with, but looked into it. As I had no qualifications really to get to that stage, I had to go and do an access course for a year to give me the kind of qualifications to at least allow me to apply to university for that. I was fortunate enough to get a place because the places are very few and far between. There's only around about 13 or 14 in each of the 3 universities in Scotland, places each year that do dietetics. So I did my undergraduate course at Queen Margaret University in Edinburgh, and it took me 4 years to do that. And again, I had my final placement within NHS 5. And I kind of started working for them just before I graduated, which was amazing, again, because the jobs at that time were very, very sparse. It's a bit better now. So I've been working there for the past just over 5 years since graduation. And between that, I also, because I had an interest in sport, I had wanted to do something in sports science. So I did a master's in sports science whilst I was working. So it was a 3 years distance learning course through Glasgow University, which was a bit of a nightmare. But finally kind of graduated from that last December. So I suppose my work as a dietitian, people will kind of think that all we do is tell people to eat fruit and veg and tell people to lose weight. So people are very scared when they hear that dietitians come to speak to them, because I think we're going to lecture them on healthy eating. I suppose the honest answer to that is, although the weight management sector of our profession is quite a large part, it's not one I've really worked in at all in the past 5 years. I've worked mostly in an acute hospital setting. So most of the people that I've seen has been a lot of gastroenterology patients, and most of the time with them it's kind of the opposite of that. It's people that have lost a lot of weight or a really low weight before they can maybe get some kind of surgery or things. So it's up to us to try and help those people regain the weight that they can. I've also worked in cancer quite a bit in the past few years, both curative and palliative end-stage cancer, and I was part of a project for a year, seconded for a year, and half the job was working in the community for older people's services, so doing home visits and going to care homes, and the other half of that was working in really end-of-life palliative care setting, which was challenging, because obviously you're speaking to people who are in pretty much the last few days, weeks, or short months of life, and communicating with them and supporting them, and more importantly, a lot of the time their family through that stage, because eating becomes such a kind of vital part of that stage at the end of life. It's a lot of families can't really control many factors in that, except they think they can control eating. So it's almost like up to us to stop families and friends forcing these poor people to eat at this stage when really they're really dying. So yeah, like I say, most of the time worked in a hospital setting, and I suppose up until COVID, I think probably the NHS in some ways had a negative kind of feeling in the public, which was quite strange considering how great it is. But I suppose the good thing from COVID we've seen is the kind of the positive message now the NHS is rightly getting. And it's been very difficult. I'm sure Hannah will agree with that. It's changed how we practice, both inpatients and outpatients. It's been difficult. And actually I then applied for a job last year still within Fife as more a clinic-based, a more specialist role, working in irritable bowel syndrome. And it's taken, I've only just started that post the past 2 months because of COVID. We all kind of got pulled back into the acute wards to try and get us through the pandemic as best as we could. But the past 2 months now, I've just started this new service. And again, like Hannah, it's trying to do things all virtually because we're not seeing outpatients face to face. So we can try to do that via telephone calls or video calls, which again has been challenging, but it's quite new and exciting thing for us to do. It's kind of forced us to kind of move forward. It's these things we've been talking about for the past few years that we've needed to do. And it's maybe taken this pandemic almost to kind of force us to change our practice, which has been great. And I suppose just to throw back into the mix, we've stopped taking students. We get a lot of students for placements in the hospital, but we obviously couldn't take them the past 8 or 9 months. So just this week, we've started to take students back in a very different way. And I had a student with me in my telephone clinic on Monday the whole day, which again, we didn't know how it was going to work, but it actually worked okay. We just had to put the phone in speakerphone, which again is a bit of an issue because it depends who you're talking to, if they can hear you or not. So yeah, there's so many challenges, and every day we're kind of still learning and evolving of how we're trying to deliver our area of expertise to the people that need it at the right time in the right place. So yeah, I think that's a brief background from me. Thank you.
Thank you, Scott. That was really interesting. Okay, so next we're going to get on to the Q&A part of the session. So if you have any questions, please just leave them in that Q&A box. So one of the first ones I'm quite keen to know is for Hannah. And we basically got a question saying maggots with loads of exclamation marks and asking, how is that sterile?
So the maggots are sterile because they're specially bred in a lab. So they're not like maggots that you would imagine. They're bred so they can't spread any infection. And when we put them onto a wound, they're often it's like a little tea bag, and they're inside and they're very, very small. So because we don't leave them on the wound for a long period of time, they're too young to develop into a fly. So yeah, they're sterile, and what they do is they would then eat all the dead tissue and like slough on a wound, and they make it nice and clean, and then that helps promote wound healing. So I hope that answers the question.
I think it does. It's so interesting. I'm never going to look at a tea bag the same again. So the next question is directed at Scott, but I guess applies to both of you. So Scott, the classes were wondering, what are the challenges of delivering a virtual service as a dietitian?
Yeah, so like I was saying, it's a kind of very different practice for us now. In my practice now, because I'm doing irritable bowel syndrome, so IBS, one of the main factors we're not looking at is really people's weight a lot of the time. So we're able to get good information from phone calls just now, and we're also looking at doing video calls, but obviously doing video calls maybe limits our patients to a degree. They need to have some kind of degree of tech and be able to use a smartphone and the app to be able to interact with us with the video. And I think, but as a profession, we're always very keen, like I said at the start, we see most of our people for weight loss. So we're looking to put weight on people. So we're really needing to be weighing those people. So that's obviously difficult to be doing virtually, unless you're able to do that, I suppose, live when they're actually on the phone to you. But it is challenging. But it's actually quite good because, like I said at the start, it's shown us how we can do things now differently. Rather than a conventional clinic for us would be, we would drag every patient to a hospital site to have their consultation, and when you look at it, you don't really need to come to the site to get that kind of expert advice. We can I've shown in the past couple of months we can do that over the phone or by video. So yeah, so it's, while it's challenging, it's actually, I'm quite excited about it because I think it's gonna save us a lot of time and effort to having to bring people to different sites.
Excellent. And Hannah, the same to you. How difficult is it to virtually assess a foot or a patient over sort of video chat and things?
It can be difficult in some aspects, but as Scott said, not all patients you need to physically examine, and quite often at the first consultation you're really getting a lot of information from the patient about their medical history and their whole story. So you're sort of getting all that information and then giving them advice, usually firstly. So it's good for patients that they maybe would have had the same sort of information if they'd actually came to the clinic for an appointment, but they don't need to come in, they can just do it on a video. And they can also show you things like, they can show you their foot and where it's hurting, they can show you their shoes or insoles that they've got. You just can't physically get hands-on and examine them and look at like the range of movement, but I suppose it helps us come to a decision as well, whether we think that they need to come into the clinic for an appointment. So deciding what to do with them from there. So.
Perfect. We'll stick with you, Hannah, for another question. So what advice would you give to someone who's wishing to enter a career in the healthcare sector?
I would say that at school, doing like English, maths, some science subjects, if you don't have those subjects, you can do different access courses as well. I think speaking to different healthcare professionals and finding out about their role to see if you'll enjoy it. Yeah, so I think
Scott,
that's all.
do you have anything to add?
Yeah, probably just agree with Hannah. It depends, because it's such a wide sector, what area you actually want to get into. But I think certainly that I've shown, or we've both shown, that you don't need the conventional route to finally get to that kind of place. It's almost like, I think the conception is unless you do these things at school and go to uni, then it's all is lost to a degree. But I mean, I wasn't ready at that point to go do it for many reasons. But when I felt I was ready, there was paths to actually go, which was great. I mean, Hannah mentioned the access course. That's the kind of the biggest thing that changed for me. Is it gave me just that 1 year's course in order to get the kind of the qualifications required to at least apply to a university. So yeah, anybody out there that thinks they want to do it now, there's obviously the conventional route, but you shouldn't be kind of discouraged from not thinking it's the right time for you, because there's plenty of opportunities beyond that to try and do that.
That's great. That's a really powerful message as well. So Scott, we have someone in the audience who really likes sport, and they're wondering how could they get into dietetics to help high performance athletes?
Yeah, I mean, that was probably one of the drivers for me, because when I was thinking of making the change, I was wanting to do dietetics and also like sport science, and it was depending what way I would do it, whether it would be the dietetics part first or the sport science part first. But I did the dietetics part first only because it was so difficult to get a place in the course, and I got offered a place in both to start with. But I took the dietetics just because I thought it's going to be more difficult to get that after if I turn that down. And again, I've just got my master's last year. So just after it happened at the beginning of the year, I was looking to get kind of work experience in more an elite sporting field. So I'd kind of made contacts for that, but obviously because of the pandemic, all that's kind of went out the window. But I've kind of made contacts with a couple of football clubs and also the Sport Institute in Stirling to try and get your kind of foot in the door, because it's quite a niche market, but it doesn't need to be high performance. I mean, it doesn't like the kind of the professional side of it didn't really appeal to me, probably because of the working hours. I was more interested to be able to do something for myself, maybe as a part-time side on my dietetics job, to do maybe not elite athletes, but certainly maybe the more kind of part-time athletes, to try and start the ball rolling from there, would be my kind of advice, I think.
That's great. Thank you so much. So Hannah, the next question for you is, what are the most challenging parts of your job?
I think quite a challenging part of the job is having like difficult conversations with patients sometimes. We sometimes have to speak about amputations, or we have to get patients admitted to hospital with infections, and quite often patients don't want to go and they don't want to get their leg amputated. So you're having to have these serious conversations with people that can be quite challenging, and also I suppose you build relationships with them. So it's hard, it's sad in a way, because you feel for them and you feel empathy towards them, so that can be quite challenging. Another challenging part is probably trying to get patients to help themselves. So a big part of our job is encouraging patients to self-manage their conditions, but I suppose before you would go to see a health professional and then they would fix your problem and then you would go. But now we want people to manage their own conditions, so that can be quite challenging, trying to encourage people to be more involved in their own care.
Okay, and we'll stick with you, Hannah. What's the most enjoyable part of your job?
Meeting lots of different people, just having conversations with people and getting to know them and what they love, and yeah, you spend quite a lot of time with patients because you're doing a treatment which could take half an hour, so you have nice conversations with people about their families and things. So I really enjoy meeting people.
Yeah, like you said earlier, it's about the people, not the feet.
Yes.
Yeah, that's a good quote. So Scott, what do you think is the most enjoyable part of your job?
Yeah, I mean, so the most enjoyable parts, I've really liked being part of, especially the hospital dietetics team. We've got an amazing team, which has had lots of ups and downs over the years. But the great thing about it is we've all kind of stuck together from that. And that's something I probably learned from the kind of joiner work as well, the kind of importance of having the team, because you can't obviously do anything, all these things on your own. I suppose one of some of the things that's been most enjoyable has also been some of the most challenging things, because sometimes when you get put in those situations that are difficult to start with, sometimes the outcome, you maybe have a small part of having a better outcome on patients or patients' families that make it actually enjoyable and very memorable. Like I said before, I'd worked in end stage palliative care, which is quite a scary field to be in. And you're having very difficult conversations with patients, but more importantly, their families. Trying to get them on board with the fact that eating's not a big part to their last few days of life. And those can be really hard conversations to try and get, because families are rightly so, I mean, this is an incredibly traumatic time for them. And then I'm kind of walking and saying, look, if they're not eating, it's okay. But I found if you can actually get them on board with that message, it takes the pressure off the patient for the last days of life. It takes the pressure off the patient's families for that kind of that time that they'll remember for the rest of their life, how awful it was. So if I can make some kind of small dent in making that a bit better for them, then looking back, that's probably some of the most enjoyable parts of my job.
Yeah, these conversations that you both have must be so difficult. So for both of you, we'll keep with Scott, but we'll ask Hannah as well. How do you not let it get all on top of you? How do you not take that home with you?
So it's difficult. I mean, I'm probably quite lucky. I don't know if lucky or unlucky. I sometimes manage to blank things out, which I don't know if it's a great thing or not. I can kind of get put at the back of my mind. I don't know if it'll ever might rear its head one day. But because I don't live in Fife, so I usually have about an hour's drive to get to work. So my kind of rule of thumb with it is, no matter how bad my day's been, I'll use that hour on the way home to try and kind of come to terms with some of the stuff you've dealt with, and try and not bring it home. And majority of the time, I won't bring it home. But sometimes you can. I mean, there's been times where, again, I'll go back to the palliative care setting. I remember one patient in particular who was dying, and the doctors kept putting feeding tubes into him, and just to almost preserve life, whereas we should have been looking to preserve quality of life. And the doctors had been in to see him one day and said, oh, well, we're going to put another tube in you. And this my poor man was actively dying. I then spoke to the doctor and we went back in to speak to this poor patient. And I said, I don't know if that's the best thing for you just now. And at that time, and even looking back now, that was a horrendous situation for everybody to be in. So part of me knows it was the right thing to do, but it didn't really make it the easy thing to do. And that's one of the few times I remember walking off that ward and I had to go and speak to one of the senior dietitians, because it just was although I knew I'd done the right thing, it just felt it was quite a heavy load to feel that you've changed this. Although the patient wasn't in agreement with it once they kind of knew the difference. But I mean, Yeah, I suppose so. Like I said, I think I'm probably quite lucky that I can dump this stuff at the back of my mind and move forward most of the time. But yeah, it's not easy sometimes.
Yeah, I can imagine it'd be pretty difficult. Hannah, how do you deal with having those conversations about amputation and things like that?
I suppose at the time, making sure that you are professional and that you're supporting the patient and things, but afterwards you can reflect on it and think about it, and it can be quite hard and upsetting, as I said, especially when you have got relationships with these people that you've been seeing for a long time. But I suppose as long as you know that you've done the best that you can for these patients and that you've given them all their options and you've explained everything, and at the end of the day the decision is down to the patient. So I suppose, yeah, when I go home, I've got a little girl that keeps me occupied, so I don't tend to get hung up on things when I get home, but it can be quite difficult.
Yeah, I can imagine. So considering that you're both career changers, we're going to stick with Hannah and then we'll move on to Scott. So is there anything that you learned in your previous roles that you use in your role today?
Well, I worked for the bus company for about 7 years because I worked there the whole time that I was at uni as well. And I suppose because in that role you meet lots of people as well, so you learn how to have difficult conversations with people that are quite upset. They might be making complaints, or you sort of learn how to problem solve, and yeah, so I suppose you take that forward working in a team and dealing with the public. So Scott, do you have anything to add?
What was the question, sorry?
Oh, sorry.
It was so is there anything that you learned as a joiner that you use in your role today?
Yeah, definitely. I mean, so the part of the team, that's kind of the bigger thing, especially when you're a joiner. For instance, maybe you're building a house. It's not like you're building that house yourself. You're kind of constantly relying on other trades to get to that end stage. You all want the same end goal with it. And again, with the communication, if you're not talking to all these other trades to get to that stage, you're not going to get to that end point. So the same kind of works with us within the team. I mean, I'm constantly talking to different healthcare professionals or doctors to try and get the patient to where we want to get them to. But yeah, I mean, so it's around the communication thing is a massive thing for allied health professionals, and probably strangely, I'm maybe not the greatest or the best communicator at times. I could probably go weeks without seeing people and wouldn't be too upset about it. But when it comes to patients, I seem to change. I'm a bit different. I always want to try and do as well as we can for them. But yeah, there's definitely crossovers from the life experience you've had for the 10, 12 years before I've came to this profession. Yeah.
Yeah, I can imagine all that life experience definitely helps you. So we're going to try and quickly fit in one more question and we'll end on a slightly more uplifting one. So who influenced you both the most to start a career in the NHS? So we'll start with Scott.
Yeah, I suppose so. Definitely my wife. I mean, she was the one that she knew it was something that I wanted to do, but without her support throughout the whole process and every way, financially, IT, she was the kind of the person, probably without her I wouldn't have done it, because I would just have thought, oh, I'm probably getting too old, it's probably going to be too difficult to do. So she kind of helped me jump off, I suppose, and just take the chance and do it. So yeah, she was the kind of the big inspiration and driving force behind me doing it.
Oh, that's lovely. And Hannah, who inspired you?
It was my sister, because she's a nurse, and at the time she was in her final year, and I think that's what made me interested, because I saw what she was doing, and so I got the prospectus thinking, oh, maybe I would do nursing as well. But then when I looked through at all the different options, I saw podiatry and thought it looked really interesting. So she inspired me initially to look into it.
Oh, I can totally relate because my sister is also a student nurse at the minute. She's in her final year now. So it's a very inspiring career, and hopefully you two have influenced some of these young people today to start a career in the NHS. So I'm really sorry that we can't take any more questions. We just have a few minutes left. If you want to find out any more information about what Hannah or Scott does, or what any other allied health professional does, you can head over to www.myworldofwork.co.uk, where you will find tons of informative job profiles, and there's also tools there that will help you identify your own strengths and what skills that you might have that link to these careers. You can also speak to your school's careers advisor. They will have all this information, and it's good to always get a chat in with them. If you want to find out more about foundation apprenticeships, modern apprenticeships, or graduate apprenticeships, you can head over to www.apprenticeships.scot. So I just want to remind you that this session has been recorded, and it will be on the My World of Work YouTube channel for you to go back and watch at any point. So I'd like to say a big thank you for our experts today. You have been incredible. You have answered the questions so well, and it was so interesting to hear you speak today. I definitely have learned new things about maggots, and also never thought that a joiner would be interested in a job in dietetics. So it's been really great to have you today, and I'd like to thank you all for listening and for your amazing questions. I'm so sorry we couldn't answer them all, but we did try to fit in as many as possible. So thank you for joining us today, and I hope you all have a lovely afternoon.